And we met Sade the other day, and I just loved what she was saying, and I thought that she had a lot to teach a lot of us. Also with us today are two of our really great moderators, Dr. Mahek Shah and Dr. Romy Mushtaq, as well as MedStarter partner Patrick Hurd. I'm Alex Fair. I run MedStarter Ventures and the MedStarter Healthcare Innovator Club here. And this is really Sade's show. So, Sade, take it away. We're going to record this just so everybody knows this is being recorded so people can learn asynchronously from Sade on how to map the value chain in healthcare. Sade, why don't you introduce yourself?
Right. Thank you very much, Alex, for this opportunity. I remember how this all got started. It was a couple of days ago when a question came up, and I was able to shed some light based on my understanding and my experience, and we thought, and that this might have to go on a lot longer than we and planned for that day. I know that I've been in a couple of rooms and I've repeated this several times as to the importance of actually mapping the system so that we can actually begin to appropriate the right technology to suit them, the interventions that we plan to create the highest impact in, and hence the creation of this room. Like Alex said, my name is Sade Adebanjo. I'm a medical doctor. I have a master's in public health and policy and strategy. And my experience has been predominantly in the African continent, precisely Nigeria and Ghana. And it's been in the area of policies, systems development, and also, creating the right strategies for development of the health sector in these environments. So, in having said that, I would want to emphasize now that most of the experience, the mapping that we're talking about, would be in relation to an emerging economy like Nigeria and Lagos, to be precise, because we're looking at Lagos with a population of 25 million and Nigeria with a population of over 200 million people. So I believe it's is in a good position to actually help us understand, populations, health challenges as it occurs in the developing world, particularly Africa. And this whole session is going to be an exchange, really. It's me, explaining what I understand, what I know to be the value chain, and also learning from other emerging economies, how things have been done and how we can actually integrate the knowledge and actually have greater impact on the continent and across other emerging economies. And so with that, I want to welcome you to this session. I hope it's beneficial. And so to start, I want to thank Mahek, Dr. Romy, and Patrick, and particularly Alex again, for setting this up and giving us an opportunity to have a better understanding. Because, from my experience on Clubhouse over the last 2 months, what I also realize is a lot of investors are interested in, coming to the continent, coming to bring in new technologies. However, there's not a good enough understanding of the processes that are required, the policies, and as well as, what exactly are the challenges that these communities are facing and how effective would be the technologies that they're proposing in addressing the problems that are on ground. And I think with this session today, it would only begin to scratch the surface, because in each area that we would touch on today, there's so many other levels. It's like peeling the layers of an onion. And with each layer, there's an expansion. It's like, it's a hydra with many heads. So we have to understand that this is the beginning of probably several sessions, and I hope we can cover. I'm just going to give a quick overview, and maybe from the questions we can then begin to, delve in deeper into other areas and other sectors that the audience might be interested in. Okay, so the health sector in Nigeria specifically is actually mirrored against the health sector in the UK, where you have the public health system and the health service delivery. And the entry point for health service delivery is primarily the primary healthcare system or sector, as is with the UK, where you have the GP system. So with the primary healthcare, the entry point, you have several primary healthcare facilities, and it actually runs on a hub and spoke system. By hub and spoke, you have several primary healthcare units across a community, across a local government, and the hub would be the secondary facility where this, primary care centers refer cases to. And then from the secondary facility, then goes to the tertiary or the super specialist or the specialist. Most people this is where we have the health services section of the health system, right? Before we get into the health services itself, in terms of health service delivery, we have the public healthcare system. The public healthcare system is, as most people understand, is where you look at your disease surveillance, health, disease education, early diagnosis, where you have programs, where you have communication materials, where you have a bit of research, and then, of course, emergency services. And I've actually tagged the key areas of this value chain under 5 main headings. And these headings are, like I mentioned, the health services, primary, secondary, and tertiary health facilities, the public health, which is the disease surveillance, early diagnosis, early interventions, emergency services, programs, research, and communication, healthcare financing, which is actually the bedrock, where you have the health insurance, the fund sourcing, probably concession management, and public-private partnerships. Then we're going to research and development. Research, product development, what products do we have and how applicable are, or how important are those products to the communities, and how are they actually serving those communities to improve health outcomes and to also improve health-seeking behaviors, right? And then finally, which is the area I know that a lot of innovators are interested in, but we can't have all these other systems working without an effective health information management system, which is where we have the data warehousing, we have the systems that actually work with data analytics, we have the e-health platforms and the telemedicine platforms. And having said, mentioned these 5 critical areas, we also need to understand that the foundation of all of this actually functioning, in line with standards and regulatory, and within the regulatory system, is to have an effective legislator, which is where the policies and what have you coming, and government and intergovernmental agencies would also come in at this point. I'm not. I think at this point maybe we should take a few questions, because we could actually start from the public health perspective, or we could start from the health service delivery perspective. Health service delivery. I'm also in. If you're going to look at the health service delivery as well, in terms of primary, secondary, and tertiary. For primary care, the first thing that jumps to mind is, if you want to look at interventions that actually tackle maternal and child health, within the populations. What are the key things within those populations that would actually expedite, engagement in those communities? What are the things that need to be done? What kind of technologies can we introduce to improve maternal health, to increase life expectancy of children under 5, and also beyond that, to actually reduce the number of critical cases that we experience due to lack of knowledge and education that would then have to go into the secondary facilities that would increase the cost of healthcare, right? So what technologies do we require for education? What technologies do we require for early diagnosis and treatment? What technologies do we require for therapeutics and drugs logistics management? Those are all the areas that, having broken down the system, we begin to understand where exactly we can actually plug in to increase efficiency, having mapped either the public healthcare system or the health service delivery system. And within these 2 areas, the 2 areas that we would even be looking at beyond that is standards and their measurements. In service delivery, we want to look at the quantitative matrix and the qualitative matrix. What determines those 2? On the other side as well, we want to look at the operational guidelines. What are the standard operational guidelines that we require within the facilities? And then also the processes of service delivery. Do we need to re-engineer the processes? What technology would be required to ensure that a patient that comes into a facility has a central billing system and not multiple platforms for billing? And how do we also, with the number of services that are being provided, begin to measure performance? And how do we put in the matrix for performance improvement? That's for standards and measurement. On the other side, right, we now look at capacity building. Capacity building, I have put it under 3 major headings: for staffing, for infrastructure, and for technology. In terms of staffing, right, we would be looking at the staff mix. What staffing do we require in each of those communities, in each facility, to ensure that there's efficiency and there are better health outcomes? What are the training needs? How do we do a training gap analysis? What forms of technology? How do we connect to more developed worlds to improve training and knowledge base for the staff? How do we recruit? On what basis are we recruiting within these areas, within these communities? And then more importantly, what are the welfare packages? I got some information from one of the rooms the other day that talked about, super specialization gradually crippling the US health system, right? What can we do in the developing world to actually not get to that point where we have a lot more GPs, a lot more primary care providers that are, in contact with their communities, giving them the services they require, and also that are satisfied with the welfare packages that they're given. Secondly, for capacity building, we'll be looking at infrastructure. What are the building requirements? Right. What facilities, what is the proximity of those facilities to highly dense areas? What is power like? Do we need solar energy? What are the operational guidelines for solar provision? What about water? Is there enough water? I mean, the provision of potable water in those communities. How do we ensure that the water system is functional? Because we know that water, more than anything else, is critical for healthcare, as we saw in the Ebola crisis and even now with the COVID crisis. Most communities don't even have water for hand washing and things like that. And then, of course, access. Alex.
Okay, well, you get to a stopping point. Let's take some questions. Go ahead, keep going.
Okay. Sorry?
No, I was saying that Sade, finish your thought on accessibility, and when you get to stopping point, we have a few questions coming up from the audience.
Okay,
it's a great dissertation, though.
I'll just talk finally on access and technology, and then we can take questions. This is the final point, actually.
Perfect.
So finally, in terms of technology, yes, again, it's the same things that we're looking at: equipment, diagnostics, therapeutics, data and analytics. How do we use information coming in from the data to better inform our interventions, to better inform the processes that we're changing, and to better increase the impact of our service delivery. I would stop now, as Alex indicated, for us to take a couple of questions from the audience at this point. Thank you.
Now you guys see why we're doing the masterclass from Sade, because she really she's dropping knowledge bombs on us. And so thank you very much, Sade. This is really instructive, and it's a really great sort of framework for thinking about these things. So I know Namuna runs the Innovation in Developing World discussions we do on Tuesdays. Cesar is also one of our moderators. So you folks other moderators, or Cesar, Namuna, Rushi, do you guys have questions for Sade at this point?
I have a first question for Sade. My first question will be, what is the most burning problem of public health system that you have noticed and you want to discuss, and maybe we can suggest solutions?
And also, how would mapping the value chain help dissect and then solve those problems? I think is to relate it back to the masterclass.
Okay, fantastic. Those are great questions. What is the most burning problem within the public health system? Fundamentally, we look at education, right? How educated and how responsive are people to new interventions that are coming in? And without some level of education, we cannot really begin to introduce new ideas, because again, there'll be a problem of adoption. So public health is the primary problem that I see fundamentally, is how do we increase education and awareness, both within the service delivery with doctors, nurses, community health workers, and also the population as well. How do we begin to put the ownership how do we put the health records of the population in their hands so they can make informed decisions wherever they're going? I'll give you an example. When there have always been traditional birth attendants, right? In most developing economies. I know they had them in the UK. They had them many, many years ago. A lot of people probably don't even remember. But I also realized that with education and improved services, there was a gradual obliteration of these services from their system. And it wasn't an immediate cutoff. The more people got aware, the more services were provided that replaced the traditional attendants. They gradually eased out of the system. So if we parallel that to what we have now, the traditional birth attendants are still within the system and operating. But what I think the error